Hey there, I'm Sophia, and I'm going to walk you through how to inject Omnitrope under the skin or subcutaneously. These instructions are broken up into 6 quick steps, which you can jump to at any time using the chapters below. Let's start by making sure you've got all your supplies ready to go. A multi-use vial of Omnitrope at room temp. A vial of diluent such as bacteriostatic water. A mixing needle, which may or may not arrive attached to the syringe, an injection needle, plus alcohol pads, a gauze pad or cotton square, a sharps container, and a clean surface. You may get prescriptions or supplies that use cc or ml interchangeably. Don't worry. They're just different names for the same amount of volume. For example, 1 cc is equal to 1 ml. Now, go ahead and wash your hands really well with soap and water. Then you're on to preparing the area where you'll give yourself the injection. There are a few places where you can inject your medication under the skin. In the abdomen, just below or to the side of your belly button, or in the leg, in the upper outer area of your thigh. No matter which area you pick, try to avoid injecting yourself in the same exact spot each time to lower your risk of a skin reaction. And never inject into any area that's tender, red, bruised, or hard. For today, I'll show you how to inject in the abdomen since it's the most common spot. First, use an alcohol wipe to clean the skin about 2 inches around the injection area. Then, give it a couple of seconds to dry while you get your medication ready. Up next, we're going to mix the powdered Omnitrope with the diluent. Start by removing the caps from both vials and wiping the tops of each with an alcohol swab. Unwrap the syringe and mixing needle. Remove the needle cap. Next, fill the syringe with air by pulling back on the plunger. Place the diluent vial on a flat surface and insert the needle through the rubber stopper and into the vial. Slowly press the plunger all the way in, which pushes the air into the vial and makes it easier to withdraw. Without removing the needle, turn the vial upside down. Make sure the tip of the needle stays submerged as you slowly pull back the plunger to withdraw the entire solution. Then remove the syringe from the diluent vial. Carefully insert the needle through the rubber stopper of the Omnitrope vial and slowly press the plunger to inject the diluent. Aim the stream of liquid into the side of the vial to avoid creating a foam. Next, remove the needle and syringe from the vial and toss them into the sharps container. Gently swirl the vial to allow the powder to dissolve. Don't shake the vial. Once it's totally dissolved, check to make sure the solution is clear with no particles floating around. If you see anything, don't use it and call your healthcare provider right away for next steps. Next up is withdrawing the medication. Unwrap the syringe. If there isn't a needle already attached, unwrap an injection needle and attach it to the syringe. Then remove the needle cap. Next, you'll draw air into the syringe, so pull back the plunger to the amount your healthcare provider has recommended. Insert the needle through the rubber stopper of the vial you just mixed. Gently press the plunger all the way in, which pushes the air into the vial and makes it easier to withdraw. Then, without removing the needle, turn the vial upside down. Make sure the tip of the needle stays submerged in the solution as you slowly pull back the plunger to withdraw your dose. This is especially important as the amount of medication decreases in the vial over time. You'll only be using a portion of medication for every injection, so it's really important to double check and give yourself the right dose, not the entire vial. Once you've drawn your dosage, you can remove the needle from the vial. Keep the syringe and needle pointing up as you remove it. Next, while still keeping the needle pointing up, check for air bubbles in the syringe. If you see any, pull the plunger slightly back and tap the syringe gently until the bubbles disappear. Then push the plunger slowly back up to the correct dose. If there isn't enough medicine in the syringe after removing the air bubbles, draw more from the vial and keep checking for bubbles until everything looks good. Now you're ready to inject the medication. So let's do it. Hold the syringe in one hand, and with the other hand, pinch a fold of skin around the injection area. Insert the entire needle straight into the skin at a 45 to 90 degree angle. Slowly push the plunger until you've injected all of the medication. Do a quick count of 1, 2, 3, and then let go of the skin you're pinching. Press down firmly on the injection area with a gauze pad and remove the needle. Nice work. Your final step is cleanup. Toss the used syringe and needle into the sharps container. And if you have any remaining doses, store the vial in the fridge and use within 3 weeks. Thanks so much for watching today. Take care.